Hello, elephant lovers! We hope you remember the elephant we treated for a gunshot in the rear leg. We appointed a ranger to look after that treated elephant. After the first round of treatments, our ranger monitored that elephant regularly, and we received an update from the ranger that the elephant we treated had reached the forest border. According to the ranger, treating the animal is ideal as it is easily reachable on the forest border. When the Department of Wildlife Conservation received the call, the department's veterinarian immediately attended to the situation with all the essential medical equipment and supportive staff. After observing the animal and the wound, the team prepared the sedative drug according to the usual protocols. They considered the body weight, the time necessary to sedate the animal, and other necessary parameters when making the drug. Once everything was ready, they transferred the sedative drug through the dart gun to the elephant's body. Through experience and professional expertise, the team successfully injects the sedative drug into the animal. Soon, the elephant returns to the forest, and the team can spot him leaning against a tree. Slowly, the power of the sedative drug took over, and the elephant fell unconscious. The team attends to the wound soon. Before the cleaning procedure started, they had to inject the necessary medicine. The veterinarian injected antibiotics, multivitamins, and anti-inflammatory drugs before the serious task was started. The amounts of drugs that will be given are calculated according to the body weight. Also, when the team attends to the wound, they consider all the surgical practices essential for a speedy recovery. But all this depends on the place where the animal is. Sometimes it is tough to carry out the routine because of the disturbances the team experiences in the natural surroundings. The swelling in the leg has significantly decreased compared to the first day they discovered the elephant, but the infection hasn't healed completely. So the veterinarian decided to clean the wound and drain the abscess once again. The wound was first cleaned with disinfectant solution in a routine manner. This will kill pathogens through oxidation bursts and local oxygen production. The dead cells in the wound will also be removed with this reaction. A cotton swab soaked in peroxide is used to wipe off the wound. Then, the accumulated tissue debris was removed using sterile swabs and forceps. After a thorough cleaning, the wounded area was flushed with saline solution. You can see how professionally the task was carried out. The vet attended to the wound with great care so that the animal received the best treatment possible. Moving on to the next part of the treatment, the team started draining the abscess. The accumulated pus was drained completely with a great effort. Can you guess what has happened to this poor animal? It looks like a gunshot. The elephant herd had come from the village border to the agricultural area, so naturally, the villagers used the most common practices to eliminate these giants. They shoot the elephants to keep them away from their crops. The same thing has happened to this elephant. So, the wound from the gunshot has grown into an abscess that has gotten more infected with time. All of this is due to the conflict between the villagers and the elephant, which has been happening for quite some time. So, after the wound is cleaned, the team applies a mixture of betadine and negasunt powder to the wound. Basically, negasunt dusting powder is widely used for antibacterial wound dressing. While the process is going on, the revival drug is applied to the ear vein. Once the elephant gains consciousness, it is released into the forest. However, the treatment should be properly continued, so we appointed another ranger to monitor this giant after the treatment so that we can continue the next rounds of treatments with this elephant on time until his complete recovery, which is sure to happen.